Breathing can feel heavy even when every test says you're fine. And that disconnect is where a lot of quiet frustration begins. You do the responsible thing. You get checked. You run the scans. You're told your lungs look normal. Oxygen levels are acceptable. No obvious red flags. And yet, when you go back to daily life, your chest still feels tight. Your breathing feels shallow. Something feels off, but there's no clear explanation. At first, you try to ignore it. Maybe it's stress. Maybe you're just out of shape. Maybe it's the weather. You tell yourself it's nothing serious because the numbers didn't say otherwise. But the feeling keeps showing up. Walking upstairs feels heavier than it used to. Seasonal changes hit harder. You notice congestion that never fully clears. You feel more tired than expected, even on days when you didn't do much. And the most confusing part is that nothing feels wrong enough to point to a diagnosis. So you start trying logical fixes. You breathe deeper. You exercise more. You drink more water. You clean your air. You try supplements that promise lung support. Some help briefly. Most don't change much. And after a while, the effort starts to feel disproportionate to the results. That's when doubt creeps in. If the tests are normal, why doesn't breathing feel normal? Most explanations stay on the surface. Anxiety, aging, sensitivity, lifestyle. And while those factors can play a role, they don't fully explain why the sensation feels physical, persistent, and specific, like a weight that never fully lifts. Here's where things usually get overlooked. Medical tests are designed to detect disease. They're very good at identifying damage, obstruction, or acute dysfunction. What they're not designed to measure is how efficiently your respiratory system is functioning day to day under low-grade stress. Think of it like a car that passes inspection but still feels sluggish on the road. The engine works. The systems are intact. But something in the flow isn't optimal. Breathing discomfort often lives in that gray zone between illness and ideal function. Most people focus on the lungs themselves, but breathing is a system. Airways, inflammation balance, mucus clearance, circulation, histamine response, and tissue elasticity all interact quietly in the background. None of these need to be broken to affect how breathing feels. When those systems are slightly off, not enough to trigger alarms, but enough to create resistance, breathing can feel heavy without being dangerous. The real issue isn't that your lungs are failing. It's that airflow efficiency is being subtly disrupted. Inflammation doesn't have to be extreme to matter. A low-grade inflammatory response in the bronchial tubes can create a sensation of tightness or resistance. Mucus doesn't have to block airways to interfere with smooth breathing. Even thicker than normal buildup can change how breathing feels. Circulation within lung tissue also plays a role. Oxygen exchange depends not just on air coming in, but on blood flow supporting that exchange. If circulation is slightly compromised, the result isn't dramatic shortness of breath, it's fatigue, heaviness, and reduced stamina. Histamine response is another quiet contributor. Seasonal shifts can increase sensitivity in the upper and lower airways, creating swelling and congestion without triggering classic allergy symptoms. Again, nothing that shows up clearly on standard tests, but enough to be felt. This is why so many people say, "I can breathe, but it doesn't feel easy." Once you see breathing as a balance rather than a pass or fail function, the experience starts to make more sense. You stop asking, "What's wrong with my lungs?" and start asking, "What's interfering with smooth breathing?" That shift matters, because it changes how you interpret your body's signals. Heavy breathing doesn't automatically mean danger. It often means your respiratory system is working harder than it should to maintain normal output. And effort, even when successful, still feels like effort. This perspective also removes a lot of self-blame. You're not imagining it. You're not weak. You're not ignoring something obvious. You're feeling the cumulative effect of small imbalances that don't trigger diagnoses but do affect quality of life. Understanding this doesn't mean chasing fixes or expecting instant relief. It means recognizing that comfort and efficiency are different goals than treatment and survival. Some people start paying closer attention to what makes breathing feel lighter: certain environments, seasons, routines. Others explore how inflammation, circulation, or airway support are discussed outside of emergency medicine, in more functional contexts. The key is that breathing comfort lives on a spectrum, and normal test results simply mean you're not in danger, not that your experience is irrelevant. When you stop expecting medical tests to explain every sensation, you gain a clearer framework for understanding what your body is communicating. And often, that clarity alone reduces a lot of anxiety. Because once you understand the structure behind the feeling becomes less mysterious and far less frightening. If you want a more structured breakdown of how respiratory balance works beyond basic testing, there's a practical framework linked in the description that explores this topic in more depth. You can also subscribe if you want more clear, grounded explanations like this focused on understanding how systems actually work, not just labeling symptoms. Breathing shouldn't feel like a question mark. And understanding the difference between normal and optimal is often the first step toward feeling lighter again.